हेलो तपाईहरु सबैलाई स्वागत छ मेरो च्यानलमा। आज चाहिँ मैले यो कार्डियोभास्कुलर सिस्टम रिलेटेड क्वेशनहरु लिएर आएको छु जुन चाहिँ गंगालाल हस्पिटलको हुन गइरहेको एक्जाममा चाहिँ तपाईहरुलाई केही हेल्प होस् भनेर लिएर आएको छु। आशा गर्छु तपाईहरुलाई केही हेल्प हुनेछ। हाम्रो क्वेशन नम्बर 1 मा रहेको छ अ क्लाइन्ट इज शेड्युल्ड फर अ कार्डियक catheterization using a radiopaque dye. Which of the following assessment is most critical before the procedure? Intake and output, baseline peripheral pulse rates, height and weight, allergy to iodine. हाम्रो यसको करेक्ट आन्सर छ डी, allergy to iodine. To determine the client's carotid pulse, the nurse should palpate below the mandible, in the lateral neck region, along the clavicle at the base of neck, at the anterior neck, lateral to trachea. हाम्रो यसको करेक्ट आन्सर रहेको छ डी, at the anterior neck, lateral to trachea. During auscultation of the heart, the nurse expects the first heart sound S1 to be the loudest at the base of the heart, apex of the heart, left lateral border, right lateral border. इसको करेक्ट आन्सर रहेको छ बी, apex of the heart. Question number 4 छ when auscultating a client's heart, the nurse understands that the first heart sound is produced by the closure of the mitral and tricuspid valves, aortic and tricuspid valves, mitral and pulmonic valves, aortic and pulmonic valves. इसको करेक्ट आन्सर रहेको छ ए, mitral and tricuspid valves. Oxygen by nasal cannula is prescribed for a client in the coronary care unit. The nurse plans to use safety precautions in the room because oxygen is flammable, supports combustion, has unstable properties, converts to alternate form of matter. Correct answer is B, supports combustion. When interpreting an ECG rhythm strip, the nurse identifies that ventricular contraction is displayed as the P wave, T wave, PR interval, QRS interval. इसको करेक्ट आन्सर रहेको छ डी, QRS interval. An electrocardiogram is ordered for a client complaining of chest pain. An early finding in the lead over an infarcted area is flattened T waves, absence of P waves, elevated ST segments, disappearance of Q waves. इसको करेक्ट आन्सर रहेको छ सी, elevated ST segments. The dyspnea during sleep that suddenly awakes the sleeper with a terrifying breathing attack is known as orthopnea, paroxysmal nocturnal dyspnea, syncope, exertional dyspnea. करेक्ट आन्सर रहेको छ बी, paroxysmal nocturnal dyspnea. The contraction of the atria propels a small amount of blood into the ventricles, which is known as systole, diastole, atrial kick, isovolemic contraction. Correct answer is C, atrial kick. Systolic murmurs are common in following group except more than 60 years of age, children, pregnant women, adults younger than 50 years of age. Correct answer is A, more than 60 years of age. Which of the following is the most common cause of aortic aneurysm? Trauma, Marfan syndrome, atherosclerosis, syphilis. Correct answer is C, atherosclerosis. Which among the following is the characteristic of rheumatic heart disease? Septic emboli, microthrombi in coronary vessels, valvular involvement, subendocardial fibrosis. Correct answer is C, valvular involvement. When a client receives streptokinase, the nurse must monitor for which adverse effect? Hypertension, hyperthermia, bleeding, tachypnea. Correct answer is C, bleeding. Which among the following is not an absolute contraindication to exercise testing? Unstable angina, heart failure, coronary artery disease, myocarditis. Correct answer is C, coronary artery disease. Which is the most common blood vessel used in CABG surgery? The saphenous vein, the femoral artery, the popliteal vein, the iliac artery. Correct answer is A, the saphenous vein. Which among the following is not influenced in the excitability of cardiac muscles? Hormones, electrolytes, emotional stability, oxygen supply. Correct answer is C, emotional stability. Which is the heart's largest and most muscular chamber? Right ventricle, right atrium, left ventricle, left atrium. Correct answer is C, left ventricle. How many cup-like cusps are consist in each side right and left semilunar valves of the heart? 2, 3, 4, 5. Correct answer is B, 3. Endocarditis is most commonly seen in mitral stenosis, mitral regurgitation, mitral valve prolapse, tricuspid stenosis. Correct answer is B, mitral regurgitation. In which condition the excruciating tearing knife-like pain with lower blood pressure in one arm, absent pulses, etc. are seen? Pleurisy, dissecting aortic aneurysm, pericarditis, pulmonary embolism. Correct answer is B, dissecting aortic aneurysm. The amount of resistance to ejection of blood from the ventricle is known as cardiac output, stroke volume, preload, afterload. Correct answer is D, afterload. The first branch of the human aorta is left subclavian artery, brachiocephalic trunk, coronary artery, left common carotid artery. Correct answer is B, brachiocephalic trunk. Volume of blood pumped out of left ventricle during systolic cardiac contraction is stroke volume, preload, cardiac output, afterload. Correct answer is A, stroke volume. Normal capillary pressure at arterial end is 10 to 15 mm Hg, 25 to 30 mm Hg, 30 to 45 mm Hg, 50 to 60 mm Hg. Correct answer is B, 25 to 30 mm Hg. Cardiac output equal to stroke volume into heart rate, pulse pressure, respiratory rate, systolic pressure. Correct answer is A, heart rate. Which artery brings blood to lungs? Superior vena cava, aorta, pulmonary artery, pulmonary vein. Correct answer is C, pulmonary artery. Normal human heart weighs about 230 to 330 grams, 430 to 530 grams, 60 to 180 grams, 600 to 750 grams. Correct answer is A, 230 to 330 grams. Normal blood pulse pressure is 30 to 40 mm Hg, 10 to 20 mm Hg, 60 to 70 mm Hg, 10 to 20 mm Hg. इसको करेक्ट आंसर रहेको छ A, 30 to 40 mm Hg. The actual contracting muscle of the heart is epicardium, myocardium, endocardium, pericardium. Correct answer is A, B, myocardium. SA node is supplied by left coronary artery, right coronary artery, coronary sinus, circumflex artery. Correct answer is B, right coronary artery. Impulse of heartbeat originates from SA node, AV node, vagus nerve, cardiac nerve. Correct answer is A, SA node. Blood pressure is controlled by adrenal gland, pituitary gland, thymus gland, parathyroid gland. Correct answer is A, adrenal gland. A patient is on beta-adrenergic blocking agent. What observation a nurse should make? Decrease in blood pressure, dyspnea, increase in heart rate, depression. Correct answer is A, decrease in blood pressure. Which of the following blood test is most indicative of cardiac damage? Lactate Correct answer is B. Troponin I. Which of the following medication is given sublingually to manage angina pectoris? Aspirin, nitroglycerin, warfarin, none of the above. Correct answer is B. Nitroglycerin. While measuring central venous pressure, the 0 point of the manometer is adjusted to anterior axillary line, mid axillary line, posterior axillary line, shoulder line. Correct answer is B. Mid axillary line. A nurse is caring for a client receiving a heparin intravenous infusion. The nurse expects that which of the following laboratory will be prescribed to monitor the therapeutic effect of heparin? PT, APTT, hematocrit, hemoglobin. Correct answer is B. APTT. A nurse is assessing an electrocardiogram rhythm strip. The P waves and QRS complexes are regular. The PR interval is 0.16 second and QRS complexes measure 0.06 second. The overall heart rate is 64 beats per minute. The nurse assesses the cardiac rhythm as normal sinus rhythm, sinus bradycardia, sick sinus syndrome, first degree heart block. Correct answer is A. Normal sinus rhythm. Which of the following disorders leads to cyanosis from deoxygenated blood entering the systemic arterial circulation? Aortic stenosis, coarctation of aorta, patent ductus arteriosus, tetralogy of Fallot. Correct answer is D. Tetralogy of Fallot. आज चाहिँ मैले यति नै 39 वटा मात्रै क्वेशन लिएको छु। आशा गर्छु यसले केही हेल्पफुल हुनेछ। यस्तै भिडियोको लागि प्लिज मेरो च्यानललाई लाइक तथा सब्स्क्राइब गर्न नभुल्नु होला।